Good morning. I think, first of all, a great appreciation for this unique conference with Dr. Sanjay and Dr. here, Sarda and all the team members. I think this is a very unique concept these days, again, that we should have some customized exercise prescription. Similar to a drug, exercise has to be prescribed in modality, dose, frequency, and not only a pathology, but also a personalized patient approach. And new data are needed to make this new science not only evidence-based and personalized, but also a precision approach. So this is a very, very important statement from the American College of Sports of Medicine. I think Plato in 400 BC told that in order for man to succeed in life, God provided two means. First, the education and the physical activity. Lack of activity destroys the good condition of every human being. While movement and methodological physical exercise can save it and preserve it, it is so true these days also. And if you see here that for every 1 hour of aerobic exercise you do, you add 2 hours of your lifespan and your general health. So there are amazing science of exercise these days going on, but that is not the problem. Problem is, why do we fail to follow? And I urge you not to just to listen my lecture here for your knowledge sake, for experience it, know the science, and adapt in your life. That will be the motive of my lecture. But definitely exercise prescription is not a new thing. Even the Susutra in 600 before the CE of India, he was the first physician to prescribe moderate daily exercise to his patients. And the modern time, the Hippocrates even, he gave the father of, we know the father of science of the medicine, who was the first physician to provide a written exercise prescription. So this is very, very important issue. Whenever we generate a prescription for exercise, there are few key elements. You assess your patient, determine the priority, what are the priorities of the health issues. The third is identify patient capacity and intervention suitability, and then you generate exercise prescription by total exercise dose. It is just like a medicine dose. The mode, what should be the intensity, what should be the frequency, what should be the duration, and how it will progress. And then you should monitor education and bring the behavior change, and then reassessment and prescription modification. So these are very, very important issues these days, especially for the type 2 diabetes and many other comorbidities, associated conditions. So I told you that the components of exercise prescription, and we will deal for that. What should be the type of exercise? Should be walking, swimming, cycling, or some specific workloads, and duration and frequency, how much? And then the intensity guidelines are the target heart rate, and these days the RPE, that is very, very important. RPE, that is the preserved perceived exertion experience. That is very, very important. So we'll discuss all that. So first we need to generate exercise prescriptions. Even though exercise prescription has become a popular topic these days, it is still a novel science that needs to be developed, remember. And today there is lack of evidence-based clinical practice and conclusive guidelines. In the light of that, suppose in my clinic I have just generated one prescription like this, where I give 10 minutes to my patient. First thing is the fit, the frequency, intensity, type, and time. And then we see the status, not active, it is not active or not, even the intention is there or not, or some activity but not enough. And then lastly, the recommended about the food care, aerobic type, resistance type, heat, or yoga, or whatever it may be. As you know, the minimum of 150 minutes of moderate to vigorous intensity aerobic exercise has been advised or recommended by the IDEC and other important guidelines. But the question is, what is missing here? So what is missing is the MOVE. That is the move to optimize your vitality and enjoyment. If you simply give a prescription like this, you just write, you do a 30 minutes of walking and this and this and that, patients are not going to follow that. I think a famous diabetic eminent person from the Mumbai, Dr. Bhaskar, he once told me, and he has also written that, all the diet charts we formulate for our patients, most of are going to the dustbin. So I don't want that this prescription also go to the dustbin. So what to do? You add the enjoyment and effectiveness of the exercise. That is the most important element. So that is these days known as FITTEE. Fit EE, that is the enjoyment and effectiveness. So this, I think, could work. You choose to move, and you just ask your patient, what do you like? You like walking, you like swimming, playing, dancing, yoga, gym going, gardening, what do you like? And accordingly you do for that. And then you assess in the beginning what could be the positive adherence variables and what are the negative adherence variables. Adherence regions for communicating there could be the physical fitness, weight and figure control or relaxation, enjoyment or fun, I told you, and then the non-adherence fact regions, you give some time for that. The time restraints, lack of self-motivation, the seasonal conditions. Patients will say you, most of my diabetic patients, when they come, sir, you tell to do exercise every day, and I tell for 60 minutes, अभी बरसात है, उसके बाद फिर गर्मी है, और उसके बाद फिर जाड़ा है. So it is so cold, so heat, so raining, so what to do? So that is it. Also the boredom of the dislike of activity. So think about it. Then you assess about, in your diabetic patients, whether they are suffering from some nervous system disease, metabolic system disease, or urinary system disease, and accordingly we will deal and we will tell you what to do. So first thing is, in our practice, we have some sort of medical clearance. Like individuals should not begin exercise if the blood glucose is more than 250, if moderate or high levels of blood or urinary ketones are present. So these are some of the things which has been given. And for anyone, usually insulin or taking sulfonylureas, it is important to carry rapid-acting carbohydrate source to prevent the hypoglycemia. And then I told about the RPE, that is the rating of perceived excursion, and that rating has been basically 1 to 10. And that is very important. If a patient is thinking he is doing very light activity, it is 1, or if it is doing very vigorous activity, and he is thinking, I am doing very vigorous activity, it is 7 to 8, and like that, it is very easy to follow it. The next part in my exercise prescription, before I tell them that you go for 20 minutes or 30 minutes or 60 minutes, tell a bit about science of exercise to your patient. If you are not explaining this, the whole problem will persist and your exercise prescription will doomed to fail. So in very short, you tell them what is happening. Exercise is $1 billion drug and never gets prescribed. This gentleman, the Phil Sutherland, is a type 1 patient. And he has written a book known as Not Dead Yet. I think I will urge you to read that book, how he has formulated a type 1 diabetic novo, this team, and he has done this patient has done so many work that we are following in our ADA guidelines these days. There are lots of exercise benefits you know. So you tell that insulin is not, I tell, look, when you do exercise, insulin is not required for glucose to enter into the cell when you do exercise. This is a form of non-insulin dependent glucose uptake known as, remember, CMGU. That is contraction mediated uptake occurs when you do exercise. This is a great thing, great knowledge. That insulin is not at all needed when you contract your muscles. And जब पेशेंट्स के साइक में अगर आप इस चीज को घुसा देते हैं, वो समझ जाता है कि when the muscle will move, insulin is not needed, the sugar will burn, and glucose level will come down, he will do exercise. So essentially, muscle contraction allows glucose to enter the cell. The second thing that these days there is a misconception that only doing aerobic is okay. This is not okay. The science is telling you that resistance exercise is very, very important. And this resistance training is more effective in improving this GLUT4 number and the function, and highly effective in slowing sarcopenia. These days, Dr. Rusha was also showing you the sarcopenic obesity, like a just epidemic. So thus to slow the sarcopenic obesity or sarcopenia, which has a close association with type 2 diabetes, you need resistance exercise. And you can see here what are the benefits with aerobics and what are the with resistance. If you see the strength, muscle fiber size, natural adaptations, exercise performance, there are many things where only resistance exercise can bring the advantage, not the aerobics. So what to do? Even if you want in these COVID days to boost your immunity, you see here what is happening. Billions of lymphocytes are mobilized in response to just a single bout of exercise. Are you aware? Billions of lymphocytes, particularly if the exercise is a dynamic and taxes the cardiorespiratory system, like running, cycling, or rowing. So this is a very, very important thing. And I show this cartoon to my patients कि तुम्हारा माइट्रोकॉन्ड्रिया जो है ऊपर में देखो कैसा है without activity, and if you are doing exercise daily, it becomes green. So my slogan is make your mitochondria green. वो पेशेंट को समझ में आता है कि something very important is being told. So there is a science here. I will not go in details, but definitely this happens. Then I tell about the type of exercise. If you see here, even the short-term aerobic exercise improves insulin sensitivity, improved mitochondrial function, and if you do vigorous aerobic exercise for 7 days, they may improve glycemia without lowering body weight. Short-term aerobic exercise in individuals with obesity and type 2 improves whole body insulin action through gains in peripheral insulin sensitivity, more so than the hepatic insulin sensitivity. Then the second thing is the resistance. I told you about that resistance exercise training in type 2 diabetes typically results in 10 to 15% improvements in strength, bone mineral density, blood pressure, lipid profiles, skeletal muscle mass, and insulin sensitivity. So which one is better? This gives you the whole picture of what resistance exercise is doing, but which one is better? Definitely the combined is better. There will be a greater reduction in HbA1c, and it will be superior to either mode alone. You can see here, if you're only doing aerobics, it enhances insulin sensitivity 20%, remember 20%. And even the reduction of the HbA1c, 0.4 to 0.5%. But if you do combine, the insulin sensitivity increases by 70%. And you see here the lowering of HbA1c occurs 0.9%. It is better than any drug. It is better than any drug. Now, what are the physiological components of common exercise activities? You see here, if you are doing yoga, walking, jogging, cycling, dancing, how much resistance it is bringing to you, and how much aerobic components. And these days, लोग बोलते हैं मेरे को समय नहीं है, 10 मिनट ही समय है. Tell them to do the HIIT, that is the high intensity interval exercise. Only 10 minutes, 5 minutes, 10 minutes. Go and read about it. Considered superior to low intensity training. So this is a very, very important concept. And even the moderate intensity continuous training is very MICT, or sprint interval training, all are very, very important concepts. About running, people do not talk about that. But remember that only running every 5 to 10 minutes per day, and even a slow speed, 6 miles per hour, is associated with markedly reduced risk of death from all causes and cardiovascular disease. And this study may motivate healthy but sedentary individuals to begin. So this is run if you can. If you don't have time, just run for 5 to 10 minutes. That could be important. Again, in rainy days and even every day, I think the yoga has been being promoted, and now lots of research is going on world, even the USA, that yogic practices improve insulin sensitivity and reduce the insulin resistance. And if you can do nothing, sorry, I think sometimes your patient will tell you, I don't have 20 minutes, 30 minutes, what to do? I tell, you only give me 5 to 10 minutes, you do the 12 rounds of Surya Namaskara. So important. And this is totally scientific studies based, whatever I'm talking about you. It is a very, very big science. By doing Surya Namaskara, you get aerobics component, and also you get the resistance component, which improves everything. Then intermittent sitting. लगातार बैठने का जो habit है, that is killing us. So, 1-2 घंटा बैठ के, this is very, very important. The trials has shown these days, this interrupted prolonged period of sitting with 15 minutes or walking after meals even is important, so you go for that. And there are lots of science for that, how even the intermittent sit, this movement is so important. If you can, patient can do nothing, you tell about, do the daily movement. Many house wives comes to our patient, as a patient, बोलते हैं मेरे को सर दिन भर टाइम नहीं है कि मैं काम करेंगे. But when we ask about what you do in your house, amazingly they are doing lots of daily works. And that is even very, very important. Lots of studies are there. Even there are some studies showing that dog ownership and physical activities has some evidence. It improves many, many things, and because it motivates also you. So this is a very also important. So I will not go in detail. This 2020, what are the exercise, physical activity, and type 2, there are consensus statements regarding the aerobics, resistance, flexibility, balance. Everyone saying you 150 minutes of walking per week. I don't think this is good for India. My slogan is at least 60 minutes walking per day. This will bring you the desired changes which we want, because we are taking lots of carbohydrates, and we are already, there are some genetic components, other things, so 60 minutes, remember. So these are all available. Now the patients will again ask you, sir, किस time में करें? सुबह में time नहीं मिलता है तो क्या करें? Now the research is showing that even the evening workout is very, very important. I will not go in detail, but the research is there that the afternoon exercise is more efficacious than the morning exercise in improving the blood glucose levels in an individual with type 2 diabetes. You can see here what is happening with the morning exercise, and when the same amount of exercise with same intensity being done in those cohorts, getting better control of the glucose and other parameters with the afternoon exercise. So, I think the take-home message will be, whatever time your patient gets, tell him to do. Even at 12 at night, no problem. 8 o'clock, any time. So this will be better. So, but anyway, the science is saying you that the afternoon exercise is more efficacious, because the glucose tolerance, insulin sensitivity, and muscle oxidative capacity, so circadian oscillations. So that is the reason why it is more efficacious. Now the patient says, kitna kare? And if I ask you, which one is more important, intensity or duration? Which one? ज़्यादा इंटेंसिटी का एक्सरसाइज करें कि ज़्यादा देर तक करें? The current research clearly says that intensity is more important than the duration. At low intensities for an extended period of time, the fat becomes the primary fuel source, and this is far less efficacious at the lowering the blood glucose levels. And intensity ranging from moderate to high utilize more carbohydrate for fuel, therefore are more efficacious at lowering the blood glucose. Madam, please tell me 2 minutes before. Yeah. Now the last point or last part of my talk will be, kitna kare? And if you see this story, why these Philippites die from the marathon itself. The Greeks sent there the fastest runner, Philippites, to carry home news of the victory. He sprinted 26.2 miles from the battle site to the city-state of Athens, and he arrived and said, "Rejoice, we conquer," and died from the exhaustion. The marathon race is named after this event, you know. So we need customized exercise prescription. This is the reason. And in our diabetic patient, the dose matters. Like there are lots of scenarios of patients are coming. Could be the newly detected, no comorbidities. The second scenario could be osteoarthritis of both knees, could have the proliferative retinopathy, some might have the CKD, some might have the CHF. So there is science these days, having autonomic neuropathy, peripheral neuropathy, with pregnancy, many cardiac issues, you need to apply those signs. Even you have to concern with the hypoglycemia, how to prevent that. And concern with the hyperglycemia, when not to do that. And non-diabetic medications, like someone is taking like beta blockers, which blunt the heart response to exercise and lower the maximum aerobic capacity to 87% of expected negative inotropic effects, or beta blockers or other things. So these knowledge is also important. But the important points are the autonomic neuropathy, be aware of an increased likelihood of hypos, abnormal blood pressure responses, and impaired thermoregulation, as well as elevated resting and blunted maximum heart rate. So take a step to prevent the dehydration and hyperthermia and hypothermia in those cases. So there are some of the things you will get in all the ADA guidelines, and they are in all the sports medicine guidelines. In autonomic neuropathy, what to do with the peripheral neuropathy, where they limit the exercise participation that may cause foot trauma, not weight bearing exercise. But I will only touch about like diabetic retinopathy is very, very important. But remember, the moderate intensity physical activity is associated with a lower risk of diabetic retinopathy. And mild non-proliferative retinopathy, all activities we permit, but early I am saying needed. For the moderate non-proliferative disease, activity like powerlifting, which may significantly increase blood pressure, should be avoided.
Sorry to interrupt, sir.
But so in nephropathy, then also it is very important to improve your erectile dysfunction, which is a huge problem these days. But it improves exercise, and most of my patients, I don't use any medications. I only tell about to do that, and this improves their function. So it also improves the sex drives of women and also men. Only 2 minutes. And type 1 diabetic also, there are lots of things what to be done and what to be not done. You should be aware about that. In the hypertensive cases, in the diabetic kidney disease, so everywhere there is role of even the CKD with a stable angina, with pacemakers, with post-coronary angioplasty, lots of in pregnancy also. It is very, very important. You should be aware about all those things. I think for next 2 or 3 slides I will show you, and I will end here with the exercise and diabetic foot ulcer. But last point is, here, see here, the exercise in older adults and diabetes. This is again a huge gray zone. And I think you will remember this poem by our great ex-Prime Minister Atal Bihari Vajpayee, जिसने कहा था कि उम्र घर चाहे जैसा भी हो, उसके एक कोने में खुलकर हंसने की जगह रहना, उम्र की जैसी तैसी, and this is also very, very important. So final points are, each type 2 diabetic patient or type 1 diabetic patient is unique. Do assess what sort of exercise suits. Do encourage aerobics, resistance exercise and yoga. Do generate an exercise prescription. And do not sit if you can stand. Do not stand if you can walk. And do not walk if you can run. Thank you very much. Thank you.